If you want to know what to do if you have your loved one critically ill in intensive care and you don't have access to the medical records and how to get information, stay tuned. I've got news for you. So today I have an email from one of our clients who doesn't have access to the medical records yet, but has some information. And here is how we break the information down while she's getting access to the medical records. It's really important for you to understand as much as possible when you have a loved one critically ill in intensive care, because if you don't, you're simply fighting an uphill battle, because the biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. So let's get into the email. Hi, Patrick. I just giving you this report in this email. I just got another call from one of the other doctors in ICU. They are really pressuring me. The doctor says my husband has a life-threatening hemorrhage. His hematocrit is 17. It was 23 yesterday and 26 the day before. They are giving him a unit of blood now. Says he will need more. He also says that they need to do an embolization procedure, but could have problems finding where he is bleeding from. They said his blood pressure was low. I asked why they had him on 5 blood pressure medications yesterday if it was so low. He said, well, yes, that could have contributed to low blood pressure, but the bleeding is why it's low now. He again pushed for a DNR, do not resuscitate. My husband developed a spontaneous bleed when they started anticoagulants. So he's suggesting a conservative approach, give blood, stop anticoagulants instead of embolization procedure. He could have another heart attack from this, and they want to make him DNR. I would appreciate if you could call me ASAP after looking at everything, and I will sign up for more consulting time as needed, which is something the client has done. I've already spoken to the client. So let's just, that's just one part of the email. So let's just break this down. Yes, if hematocrit is low, it's likely that hemoglobin is low, but the hemoglobin is really what drives the blood transfusion. So it's not actually the hematocrit. So, you know, and I know that husband had a unit of blood. In terms of embolization procedure, well, after talking to the client, they don't even know where the bleed is coming from. So therefore, an embolization procedure is definitely not an option at this particular point in time, you know. So in the combination of antihypertensive medications and a bleed is always causing low blood pressure, right? So again, if you don't know what you don't know, you don't even know what you're looking for. I'll come to the comments about, you know, the pressure on making our client's husband DNR. I come to that after I've given you the full picture of what's really happening. So, then the email continues. I have sent you some pictures of her ventilator monitor and medications that he's getting. And my husband was admitted to X hospital on the 8th of October, had shingles for 2 weeks, falling down for past 2 days, headache. And then we had to call the ambulance. He had seizures in the ER, and they asked me to put him in a medically induced coma. They asked me for permission. But unfortunately, no one even attempted to call me until the next day. I found out from the RN that they didn't put him on antivirus until day 3. Only on the 9th of October was I notified with everything that was happening. On the 14th of October, my husband had a cardiac arrest brought back in 5 minutes. The ICU nurse told me his electrolytes may have been off when I asked why. Also found out later they were doing a breathing test for the first time. He got tachycardic. They are much more careful since then to watch his heart and breath rates when doing this. I just had another call from one of the ICU doctors who's once again doubling down on me to make my husband a DNR. The doctor rotated in on Sunday, so this is her 6th day on the case. She said she sees no improvement since she came on, pressuring me. What would my husband want? This is not about what you want, she says. This is about my husband's quality of life and could he live with it. I told the doctor to stop with the fear tactics. Once again, I am well aware I need more time to make an informed decision. She clearly doesn't like it that I'm not taking her word for it. She's worried my husband will be institutionalized for the rest of his life. Said if my husband had another cardiac arrest, would I allow DNR? I said no. Then on with the guilt trip. I am now getting texts from my siblings also trying to pressure me. So this is today's update from one of the doctors. So my husband developed blood clots in her arms, and they have her on anticoagulants, Lovenox. He now has a bleed which they haven't located yet. They're giving him blood today. They're doing a CT scan. His white cell count had improved somewhat down to 22,000. Now it's at 36,000, which is very high, and it implies that there's a infection. My husband also had a previous UTI, which I understand cleared up. They have not been able to find the source of this infection. Could it still be from the encephalitis? Yes, absolutely. It could still be from the encephalitis, but you also mentioned down in your email that there's potentially a pneumonia. The reality is that someone in ICU is at high risk of developing an infection one way or another. So the email continues. So the bleed and the infection and increased white cell count were the reasons the doctor were pressuring me again. The doctor told me her role is to tell me what's happening and my role is to do what my husband would want. And I told her, I'm doing the research and I need time to make a reasonable, informed decision. And I won't be pressured, so I suggest to stop now. Been really bad since the day after my sister had the cardiac arrest. After my husband had the cardiac arrest, I spoke with the cardiologist 3 days ago, and my husband's heart rate is back at baseline. He feels he's at minimal risk for another cardiac arrest and feels he was doing well overall. His left ejection fraction is back to 50%. He was diagnosed with a stress-induced cardiomyopathy, which I know can heal in a few weeks. And that also means that probably the ejection fraction was down a fair bit earlier when your husband had the heart attack. We were also told he's in heart failure. That is no longer true. Of course, they didn't voluntarily let us know these things I asked. This doctor also told me his blood pressure was low today. I said, I'm aware you have him on 5 high blood pressure medications. She added 2 more in yesterday that my husband had been taking at home. The RN said the goal was to keep his blood pressure below 150 systolic. They restarted spironolactone 25 milligrams yesterday, also on amlodipine 10 milligram, hydralazine 25, 8-hourly, losartan 25 milligram daily, metoprolol 50 milligram every 6 hours. That's a lot in terms of antihypertensive medications, and no wonder that with having the bleed and those antihypertensives that the blood pressure would have dropped to a very low level. I've seen in one of your pictures, blood pressure was 78 over 40 something, very low. As you can see in the pictures I sent you, his blood pressure was very low last night. The bells chimed and the nurse had to give him something to bring the blood pressure back up. All these blood pressure medications make no sense to me. But it does make sense if your husband had high blood pressure beforehand and that they were continuing it in ICU to keep his blood pressure down. However, it's also important to note that your husband is on propofol quite a fair bit actually, and that's also one of the side effects of propofol is low blood pressure. Okay, so all of that is important to know. Then I also found out last night that they didn't start him on acyclovir until day 3. They also didn't give him TPN until about day 11 to 12. I kept asking, how can he get well without nourishment? My husband has kidney failure. However, I am told his kidney is functioning well. Now, in regards to the TPN, you need to find out why they were not giving him any nutrition, because it sounds to me like he had no nutrition until day 11, but you didn't know why. So you're absolutely right. How can he get well without nourishment? He can't, So you need to get onto this and find out why he hasn't been having nutrition. That's negligence, by the way. Early feeding in ICU has shown improved outcomes for patients. Now, the email continues. Per nurse last night, fever, 38.4 Celsius. He has been running a low-grade fever continually since the diagnosis with pneumonia, which is now clearing up apparently. His last CT scan of the lungs looks good, I am told. Lung secretions have been white or clear recently. He's still on anti-seizure medications. He has not had any more since in ER and has had 3 EEGs now, not showing any seizure activity, and swelling is down in the brain. What other info should they be telling me from the EEG? From the EEG, what has the brain activity been? Is it normal brain activity? Is it seizure brain activity? Is it diminished brain activity because of potential brain damage? The doctor said she doesn't think my husband can have a good recovery and would likely be institutionalized for the rest of his life. His morning venous blood gases were good per nurse, no ventilator changes on anti-seizure meds Keppra, 1250 milligrams 2 times per day or every 12 hours, and valproic acid, 500 milligrams every 8 hours. On cefepime 20 last dose. On acyclovir started on the 10th. Propofol for sedation continually. Gave him fentanyl for spontaneous breathing trial and giving it PRN. He was able to breathe on his own for 1 to 1.5 hours. Yesterday has been up to 3 hours previously and as low as 5 and 10 minutes, not consistent. Please tell me what other info I can provide you with. The nurses are good about answering my questions. I would like to have a consult with the ASAP, which we've had. I will be signing up here momentarily. Please let me know when you are available. Yeah, we've done that. So, yeah. So, what you need to find out is obviously where's the bleeding coming from. Why are they not stopping the propofol? You did mention when they stopped the propofol, he apparently gets agitated a fair bit, right? And therefore, if he gets agitated, you know, what else is happening? They need to do a CT scan of the brain or an MRI scan of the brain to rule out any brain damage, right? And also, they need to give you access to the first MRI on day 1 or day 2, which you haven't seen yet, right? Furthermore, they need to start talking about a tracheostomy and not about DNR. You know, if your husband wants to live, which it sounds to me like he wants to, then they need to do a tracheostomy, and it's not up to them to make him DNR or pressure you to a DNR and talk about end of life. What's the hurry in killing someone? What's the hurry about end of life here? You know, what's the hurry? Those are questions you need to ask in all seriousness. So I hope that helps and answers all your questions. I've worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can confidently say that we have saved many lives with our consulting and advocacy. And you can verify that on our testimony section at intensivecarehotline.com. And you can verify it on our intensivecarehotline.com podcast, where we have done client interviews. And you can watch videos there and podcast interviews with clients that verify the work that we've done for them and with them. And we have helped hundreds of members and clients over the years, like I said, helping them to save lives, change lives to the better, stop intensive care teams from withdrawing treatment prematurely and unreasonably. And that's why we created a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com. If you click on the membership link, or if you go to intensivecaresupport.org directly, in the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded. And those resources will help you to make informed decisions, have peace of mind, control, power, influence. And that will help you and get best care and treatment for your loved one always. I also do one-on-one consulting and advocacy with you over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. And I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. I also talk to doctors and nurses directly, and I ask all the questions that you haven't even considered asking but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time, and so that you can get a second opinion in real time. We also do medical record reviews after intensive care. If you have unanswered questions, if you need closure, or if you are suspecting medical negligence, and all of that you get at intensivcarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivcarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. I also do a weekly, and share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show. And you will get notification for the YouTube live if you are a subscriber to my email newsletter, or if you are a subscriber to my intensivcarehotline.com email newsletter. Thank you so much for watching. This is Patrick Hutzel from intensivcarehotline.com, and I will talk to you in a few days. Take care for now.